Medication Administration Basics. This is your introduction to the course today. First, we'll introduce ourselves to the others in the class. The course objectives will include completing a test and an observed skill assessment to pass medications following the conclusion of the class. The class structure includes a 4-hour course, a mix of PowerPoint instruction, workbook exercises, and direct interaction with an instructor. The course is divided into 5 sections which correspond to a section in the student handbook. There will be one 15-minute break, and there will be a competency testing at the end, which includes a written test and a demonstration. Please turn to Section 1 in your student handbook. This is Section 1, Introduction to Medication Administration Basics. The section will cover what is a medication, drug classification, Schedule II medications and controlled substances, purpose of medications, desired effect and adverse side effect monitoring, psychotropic medications, diagnosis, and populations served here at MDM. What exactly is a medication? A medication is any substance used internally or externally to care, treat, lessen, or prevent a disease or symptom. Medications can either be over-the-counter, something that you are able to purchase without a prescription at your local drugstore or pharmacy, or prescribed by a healthcare professional, and this requires a signed doctor's order. Some medications can serve a variety of purposes. They may be designated in one specific class or for one specific purpose, but they do have functions elsewhere, and a doctor can prescribe the medication for purposes other than what it was originally intended. Medications can cause side effects that staff should monitor and watch for. Now we will discuss drug classification. Medications have different classes based on a common use and action. An example would be antidepressant, antibiotic, an analgesic, anti-anxiety, sedative, mood stabilizer, or laxative. This is not an inclusive list. They can be brand name or generic. An example of this would be Tylenol versus acetaminophen. They have the same active ingredients, however, one is brand name and one is a generic. Medications can be prescribed for treatment outside their original classification or purpose. An example of this is Remeron, which is classified as an antidepressant, used to treat major depressive disorder. However, a side effect is drowsiness, so it is often prescribed for insomnia. Some medications are classified as controlled substances. These require special handling instructions that we'll talk about later on in this class. Information about medications and drug classification can be found by checking the PDR, a nurse drug guidebook, the healthcare manual, pharmacy leaflets or printouts, asking the physician or prescriber, a printout from a website. Each site has a PDR, a healthcare manual, and the printouts for each medication prescribed to a person. In your student handbook, please stop to review the medication classes form. Schedule II medication and controlled substances. The manufacture, possession, and use are regulated by the government under the Controlled Substances Act of 1970. Controlled substances carry a higher risk of abuse or dependence. Controlled substances are counted and stored in an area with a double lock system at site. The pills are counted each day to ensure the supply hasn't been tampered with. The pills are also counted and documented each time they are administered. And there's a reference sheet included in your handouts. And a list of controlled substances is in there, and some common controlled substances are considered Ritalin, Vicodin, and Percocet. In your student handbook, stop to review the Schedule II controlled substances form. Now that we have discussed the classification of medications, let's discuss the purpose. Medications are usually prescribed for the alleviation of a symptom, to stabilize the condition. A good example of that would be blood sugar for a diabetic and the administration of insulin to correct that, cure a disease or infection, and some medications can serve multiple or different purposes, as we have discussed in previous slides. Since every medication is prescribed for a specific purpose, along with that purpose comes a desired effect. The desired effect is what occurs as a result of the medication being prescribed that is desired. For example, symptom management. If a diabetic is prescribed insulin, they take the insulin and then their blood sugar is stabilized, then that is a desired effect. It can also be used for the prevention of illness. An example would be a flu shot being given to prevent getting the flu. Behavioral modification. Psychotropic medications are often prescribed to have a desired effect on a person's behavior or symptoms of mental illness, or to restore or maintain bodily function. An example of that might be a prescription for Detrol LA to help a person who is having incontinence issues manage bladder function. There are also adverse side effects, and these are side effects that are not wanted, and they range from mild discomfort to very serious. A mild discomfort might be an upset stomach. A severe response or side effect might be anaphylactic shock or allergic reaction. Side effects are often identified and predictable in the general population, and you'll find out what people had encountered while taking the medication by reading the PDR or the side effect sheet that comes with the prescription when it's delivered from the pharmacy. There are a few other terms used when talking about effects and side effects of medication. An unusual effect would be when a person experiences an uncommon reaction, such as hyperactivity instead of drowsiness after taking a sedative. There is also no apparent effect, and that would mean that a medication didn't have any effect on the person or the condition it was prescribed for. A drug interaction would be when a drug has directions not to take with a specific other drug due to a reaction or reduced effectiveness. A food interaction would be when a certain food or drink interacts with the medication, changes its effectiveness. Staff should be familiar with the side effects of medications prescribed to the person they are passing medications to. Staff should observe the person for side effects and ask the person more details if they report a side effect. It is also important that staff document in the health progress notes regarding any observed side effects. If the side effects are uncommon and causing discomfort, contact the prescriber for directives. If any seriously adverse side effects such as severe allergic reaction occur, staff should call 911 immediately. Some psychotropic medications may have monitoring tools that are specified by the prescriber. An example of this would be the Monitoring of Side Effects Scale, or MOSIS.
Psychotropic medications. Some service recipients take medications for mental illness. The purpose of these medications is to alter mood and/or behavior. Common psychotropic medications include antidepressants, anti-anxiety, and antipsychotics. Knowing the symptom of each medication and what it is prescribed to alleviate is a requirement of Rule 245D, and it is the rule in which the residential settings that MDM has operates under. There are two potentially serious conditions associated with the use of psychotropic medications. These include tardive dyskinesia, which causes psychomotor issues that can become permanent if not addressed as soon as possible, and neuroleptic malignant syndrome, which is life-threatening. There are monitoring tools that assist in identifying undesired side effects. These include the MOSIS, which is the Monitoring of Side Effects Scale, and the DISCUS. Stop to review the MOSIS and DISCUS forms in your student handbook.
Another important aspect of being responsible for medication administration is understanding diagnosis. There are several different types of diagnoses, and this is a very short list of commonalities that you may find in broad categories while working in residential services. The first is developmental disabilities, or DD, and it is a mental or physical disability that occurs before age 22 that results in substantial functional limitations expected to go on indefinitely. Oftentimes, IQ is impacted. Traumatic brain injury, or TBI, which is caused by an open or closed head injury that subsequently impacts functioning. Mental illness, or MI, which has a broad array of specific diagnoses that could include disordered thinking or mood, noticeable maladaptive behavior that impairs functioning. And mental illness is caused by a variety of factors, including genetics, physical, chemical, biologic, psychological, or social and cultural factors. Lastly, medical conditions, which impacts a person's health and well-being. They often require medication or treatment to alleviate symptoms or maintain normal bodily functions. Since the people we serve often have limitations in their ability to manage these diagnoses independently, it is very important that staff understand and assist them so that they are best able to manage these and stay healthy. MDM Rubicon serves persons with DD, MI, and TBI who receive waivered services. These individuals likely have deficits in areas of functioning and require more support in activities of daily living, including the management of medical needs and medication administration. Some service recipients are able to participate in the process of medication administration and strive to be more independent in this area. Others fully relied on trained staff for this support. It is very important that staff pay attention to the specific program plans in place for each individual so that they are able to assist them accordingly.
This is now Section 2, Responsibilities of Medication Administration. Please turn to this section in your student handbook. In this section, you will learn who can pass medications, the staff responsibilities, the 7 rights of medication administration, calculating dosages, common abbreviations, systems in place to check medications, how to give or pass medication, proper storage of medications, proper destruction of medications, and ordering and receiving medications.
Who can pass medications? Unlicensed staff must be delegated this task by an RN or an MD, and that is the person's healthcare professional, nurse, or nurse consultant for the company. MDM has nurse consultants that we use who oversee the unlicensed staff, and they have delegated the task of medication administration to the staff persons. Minnesota Rule 245D establishes standards to ensure that quality services are provided to the persons in community residential settings. Minnesota Department of Human Services require that all unlicensed staff demonstrate competency before passing medications. This is why you are taking this class today. Staff have many responsibilities when it comes to passing medications. Staff are responsible to ensure the following: the medications are passed using the appropriate double and 3-check systems. Medications are passed by following the 7 rights. Medications are passed correct and accurately. Medications are stored appropriately and safely. Documentation is completed for every med pass. Staff monitor for side effects and follow up when needed to ensure proper care of the person. And staff make sure that there is an appropriate supply of medications available for each person for each medication pass. First, we will cover the 7 rights of medication administration. These are very important because they help ensure that the person that you are serving has medications administered correctly each and every time. The first right is right person. Always check that you are administering the medication to the right person. Since we serve more than one person in a home, it's very important to double check. Right 2 is right medication. Make sure that it's the right medication each and every time. The third is right date, making sure that it is given on the correct date of the month. 4 is right time, meaning the right time of day, AM, afternoon, at bedtime, or at any other specific hour that may be indicated. 5 is right dose, making sure that you're calculating the correct amount of medication for each administration time. 6 is right route, meaning how do you give this medication? Is it an oral medication? Or is it an otic medication for the ear? There are several different routes that we will learn about today. Right 7 is right documentation, making sure that you are putting down in the health progress notes and on the medication administration record the correct information and documenting that the medication was given correctly.
Calculating dosages. It is important that the dosages are correct and given at the correct intervals as prescribed by the healthcare professional. If you have questions on how much or when to administer medication, please ask. Who can you ask? The pharmacy, the doctor prescriber, the nurse, or the emergency contact person. In your student handbook, stop to review the Calculating Dosages Practice worksheet. These are worksheets that you will complete, and the answers will be checked at the end of the course. You will have 5 minutes to complete these examples. Abbreviations are frequently used in the healthcare field. A handout of common abbreviations is located in your class handbook. Most medical abbreviations are derived from Latin, and medical terminology is like learning a whole new language. Acronyms are sometimes used in specific practices. This is also true with the human service field. We have DD for developmental disability, MI for mental illness, and TBI for traumatic brain injury. Study the handout in your student handbook. There will be medical abbreviations on the competency exam today. There is also an abbreviations worksheet that you should be completing at this time. You will get 5 minutes to complete these abbreviation examples. Systems in place to check medications. The first is the triple check procedure. While conducting the 3 checks, you are determining that you have the right drug, dosage, time, route, and person. This is done by comparing the medication label on the bottle to the medication administration record, MAR for short, when removing it from the storage area. Compare the medication label on the bottle to the MAR a second time as you dispense or prepare the medication. Compare the medication label on the bottle to the MAR one last time before you administer the drug or drugs as your third check. There's also a medication double check procedure in place that occurs when you start and end a shift. Check the medication sheets when coming on shift to make sure the medications were appropriately passed and documented before relieving the other staff. Sign the double check sheet in the medication book. If issues and discrepancies or errors are noted, complete the appropriate forms, which we'll discuss later, and notify the site program director or emergency contact person. When ending your shift, the staff replacing you should perform a check of the medications that you passed for accuracy before you leave the site. In your student handbook, stop to review medication double check procedure and form. Next, we will discuss how to give a medication. The first thing that you will do is conduct your 3 checks. Remove the medication from the cabinet, match bottles and labels to the medication administration sheet, and dispense the medication to be given into the appropriate container or medication cup. Then you'll put back the medication into the cabinet. Review the 7 rights, approach the person and explain the medication process, observe the person taking the medications, offer a drink of water or other liquid, and you document on the med admin check sheets and the health progress notes that the medications were given. Always give medications one person at a time. Do not dispense multiple people's medications at once, as mistakes and errors can be made. Staff are also responsible to ensure that the medication supply is always secure so that no one gains unauthorized access to medications. Now we will cover medication administration instructions based on the type of medication being administered. In your student handbook, stop to review the Administering Oral Medications handout. This is the first type of medication we will cover, and it is one of the most common. You'll be given a couple of minutes to read this handout. The next handout is administering skin medications. This includes ointments and creams. Please refer to this handout in your student handbook and review it. Let's move on to administering eye medication. In your student handbook, stop to review the administering eye medications handout. Next is administering rectal medication. Please review this handout. Next is administering vaginal medication. Please review this handout. Lastly, review assisting with administration of subcutaneous insulin injections. Please note that although a staff person might be responsible for ensuring that the correct dosage is dialed, all service recipients in MDM's care are able to administer the injections themselves. At times there may be other injections that occur, however these will be done by a site nurse. There are a few other routes that medications can be administered, although these are a little less common. They can include sublingual or under the tongue, that is typically meant for medication that would be dissolvable. Buccal, which means inside the mouth between the cheek and the gums, and is sometimes the route of administration for an emergency medication for a seizure. Transdermal, which is absorbed through the skin. This is typical for like a patch, such as a birth control patch, where the medication is delivered by absorbing it through the skin. Inhaled, which would be delivered by a breathing in, like an inhaler or a nebulizer. And nasal sprays, which are delivered by a sniffing through the nostrils. Now let's discuss proper medication storage. Medication should be kept in a clean and dry area at all times. Medication should always be locked and never left unattended during administration times. Medication should be stored at recommended temperatures, making sure to review the pharmacy's directives. An example would be making sure refrigerated medication is properly stored. Any refrigerated medications must be kept in a locked box in a fridge or a separate refrigerated area when available. Schedule 2 medications require 2 locks. Proper destruction of medications. Each site has a medication destruction box, and inside it, there is a medication destruction procedure and a site medication destruction record. Medications that are contaminated, discontinued, or expired need to be relocated to the medication destruction box. Each person has a service recipient medication destruction record form that is also completed when a medication is put into the medication destruction box. Medications will be disposed of at the Washington County Unused Medication Drop Box. There is a designated person for disposal, and this is either the site nurse or the site program director. Staff will not be transporting medications for destruction. Designated persons will follow the procedure in place for transporting medications for disposal. In your student handbook, please stop to review medication destruction procedure and the site medication destruction record and service recipient medication destruction record. Medication ordering and receiving. Making sure that there are enough medications on site is a responsibility of all MedPassers. However, each site is likely to have a primary person who usually does medication ordering. It is important to document any ordered medication fully on the medication order and receiving form. When medications are delivered, they should be checked for accuracy immediately. If incorrect medications are delivered, they need to be returned with the pharmacy personnel. Document the receipt of the medication on the medication ordering and receiving form next to the entry in which it was ordered. Please stop and look in your student handbook and review the medication ordering and receiving protocol and the medication order and receiving form. Now we are entering section 3, documentation. In this section, you will learn about doctor's orders, medication administration record, including the monthly med sheets, the monthly doctor order treatment sheets, monthly PRN or pro rata administration sheets, monthly standing order medication sheet or SOM, and a narcotic med sheet. You'll also learn how to prepackage medications for leave, how to document in the health progress notes, and have plenty of opportunities to practice. Doctor's orders. They are extremely important and they must be in writing. They can be in the form of a fax, script, handwritten note on a letterhead, or a referral sheet. An order is a doctor's, identified as an MD, a PA, an NP, etc., instruction to start, stop, or change a medication or treatment. The order must be followed unless there is a major concern or potential error. An example would be a medication is prescribed that a person is allergic to. Always call the prescriber with any questions or concerns. Now we'll talk about adding a medication to the medication administration record, or MAR. Have a copy of the order available whenever possible. Find the appropriate sheet in the MAR. The monthly medication sheets are the daily medications that are given, usually orally. The medication treatment sheets. Treatments are brushing teeth, flossing, using a particular face wash, PT exercises, etc. that have been ordered by a doctor. Monthly PRN administration sheets are medications that are ordered by a doctor that are used on an as-needed basis. A medication for nausea would be an example, or a PRN psychotropic medication. Monthly standing order medication sheets are for medications that are on the standing orders for over-the-counter medications form and have been approved by the doctor. They can be given for various common illnesses, such as a common cold, a sore throat, an itchy rash, etc. Monthly narcotic sheet is for medications that are controlled substances or Schedule II, and they require counting on a frequent basis and tracking for making sure that the medications are not being abused or going missing. An example of a Schedule II would be Tylenol with codeine. Setting up the MAR. Make sure that you use separate lines for each medication. Indicate start and/or stop dates by drawing arrows to the appropriate dates. Transcribe the order exactly as written. Double check the 7 rights to make sure the sheet and medication bottle matches. Call the prescriber for any questions or discrepancies. Document the change in the health progress notes and communication book so all staff are aware that a change occurred. In your student handbook, stop to review medication administration example number 1. You'll be given a minute or 2 to review this. Take note at the example, and there will be a picture on the sheet that indicates the following instructions with a given scenario.
Sometimes medications are discontinued. So for discontinued medications, you need to ensure that only a healthcare professional has discontinued the medication. Write a line through the rest of the dates for that month on the appropriate med sheet. Under or over the line, write D/C for discontinued, per, and then insert the physician's name. Include the date and your initials. Changing a medication order is done in a similar way by following the same instructions as a discontinued medication. Transcribe the new order in a new line and draw an arrow to the start date for that medication. In your student handbook, stop to review medication administration example number 2. Standing order medications, or SOM for short, are used as needed for common conditions. They require a healthcare professional's signature on the standing order med consent before administering. Check the consent to see which medication is appropriate to the symptoms, and make sure no allergies or contraindications are noted on the consent form. Transcribe the SOM being used onto the standing order medication sheet. Document the medication and the time given on the sheet. Also document in the health progress notes about the symptoms, the medication you gave, and what time you gave it. Follow up in 1 hour and document the effectiveness of the medication in relieving the symptoms in the health progress notes. In your student handbook, stop to review medication administration example number 3 and the standing orders for over-the-counter medications form.
PRN medications. PRN stands for pro rata. That means that they are used as needed, but are specific to a person for a particular mental or physical condition. If the medication is a psychotropic, or for a specific condition, follow any PRN use plan in place to determine when to use the medication. Document on the PRN med sheet the date and time given. Document in the health progress notes when given, and follow up in 1 hour to document results. In your student handbook, stop to review medication administration example number 4. Narcotic medications are used as needed, but are specific to the person for a particular physical condition. The quantity of these medications is tracked on a med sheet and according to protocol. They are considered Schedule II and need to be double locked. Document in the health progress notes when given, and follow up in 1 hour to document results. In your student handbook, stop to review medication administration example number 5 and administration of Schedule II narcotics protocol. Pre-packaging medications for leave. When should you pre-package medications? The answer is any time a service recipient will be off-site for a medication administration time. Label envelopes or a MediSet if the person has one with the person's name, name of medication, strength, amount, route, date and time to be given, and any special instructions. Sign the envelope or MediSet. 1 envelope per med time per day. MediSets will need a sheet that goes along with the MediSet that identifies the information that would otherwise be on an envelope. Document on the med sheet L in half the box and your initials in the other for the medications that are pre-packed for that specific administration time. Transfer pre-packed medications to the person responsible for administering them. Be careful not to give responsibility to a service recipient if they need assistance with medication administration. It is very important that another responsible party takes responsibility for these medications when a person leaves. Fill out the medication sign-out log and have the person responsible sign. Document in the health progress notes. In your student handbook, stop to review medication administration example number 6 and the medication sign-out log form. Now we'll discuss a very important part of documentation, called the Health Progress Note. This is a record of the person's physical and medical well-being. These are considered legal documents and can be used in court proceedings. Documentation is done in ink only, no whiteout is permissible, and mistakes should be corrected by drawing a line through the incorrect information and initialing the change. Always document on PRNs, standing order medications, and regular administration of medications. Any side effects observed, any accidents or injuries, scratch, bruise, etc., each shift until resolved, signs or symptoms of illness, any protocols regarding the medical or physical health of the person, include the date and time of every entry, sign your name legibly after each entry and include your title, read them each shift and initial that you have reviewed them so that you stay up to date on the most frequent and important information for the person. Stop to review how to write health progress notes procedure and medication administration examples 1 through 6. Now it's time to practice what we've learned thus far. In your student handbook, you should see a packet of forms labeled scenarios. These are for our example person, Joe Schmo. Individually, you will be given 30 minutes to go through and complete each scenario and the appropriate forms. You should be able to complete all scenarios within the 30-minute time frame. You will cover the answers to the scenarios with your course instructor following the 30 minutes. Please begin now. Now that you've completed Joe Schmo scenarios, it is time for a break. The break will be 15 minutes in duration. There are bathrooms outside the training room. A smoker's post is located in the back of the building, and water can be obtained from the cooler in the front office. Your instructor will now tell you the time at which you need to be back to the classroom.
Now that we've had a break and covered the answers to the scenarios, we will begin section 4 of the class, Meeting Service Recipient Healthcare Needs. In this section, you will learn when to call a healthcare professional, how to conduct appointments, complete referral forms, document directives and orders, and follow up on accidents, illnesses, and injuries. When to call a healthcare professional. Staff are responsible for the health and safety of service recipients at all times. Staff need to call a healthcare provider if there is a question or concern about a medication, a side effect or symptom that the person might need care for is observed, there is an allergy or other issue with the medication ordered, there is a potential need to be seen by the healthcare provider due to an illness or an injury, or medication needs to be changed or discontinued. Medical appointments. It is very important that a service recipient receives proper care. This includes attending regular medical appointments to manage health, both for regular checkups and for specific healthcare needs. Staff need to make sure the service recipient follows up with healthcare providers on the schedule the provider has indicated as adequate. Each person has a service recipient health needs schedule, and this should be followed as a guide for when the appointments need to be scheduled with various healthcare providers. In your student handbook, stop to review the service recipient healthcare needs schedule form. Referral forms are a very important aspect of medical appointments. Staff may be assigned to set up and attend ongoing healthcare appointments. All staff are responsible to take a person or to conduct a medical appointment if it is scheduled. A referral form needs to be completed and taken to each and every appointment, and there are various types of referrals depending on the type of healthcare provider being seen. The physical exam referral is taken once a year to the primary care provider. The medical referral is taken to each and every healthcare-related appointment with any provider throughout the course of a year. A mental health referral is taken to the prescribing party for psychotropic medications, usually a psychiatrist. The therapy progress report goes to physical therapists or psychological related therapy, such as a therapist or counselor. The ophthalmology referral goes to an eye doctor, and the dental referral to a dentist. Any result, order, or directive following an appointment needs to be documented in the health progress notes. Any doctor order needs to be implemented, and a supply of the medication obtained from the pharmacy. The MAR needs to be updated if a change occurred. Stop in your student handbook, review the different types of referral forms. There's also a scenario to complete regarding filling out the correct referral form for an upcoming appointment.
Documenting provider directives is very, very important. Any directive given by a healthcare professional needs to be transcribed into the health progress notes. If an order is issued for a medication or treatment and it is not documented on the referral form, make sure to request a copy from the provider. If the order is sent directly to the pharmacy, they are able to print and provide a copy of the order as well. Make sure to inform other staff persons resuming care for the person to read the health progress notes and get an up-to-date information on any changes or directives. Accidents, injuries, and illness and follow-up. What to do if a person has an accident or injury or an illness. First, all staff are first aid trained, so apply any needed first aid. Notify the team members as indicated in the program plan for the person. Complete an accident injury report form, document thoroughly in the health progress notes, and follow up later on the injury or illness in the health progress notes. If it is an illness, make sure to check for signs and symptoms of illness or injury, and also administer any standing order medications that would be appropriate to the situation. At this time, we have another scenario for an accident injury report on Joe Schmo. Please take 5 minutes to complete this scenario. Remember that if a person is ill, you should double check signs and symptoms of illness in the healthcare manual, follow instructions for the specific illness, make sure to administer any standing order meds appropriate to the situation, document in the health progress notes, follow up regularly, and if it's an emergency, always call 911. If there is a need to see a health care provider urgently, arrange the care for the service recipient as soon as possible. Now we'll discuss Section 5. This is the last section of our course before our test and observed skill assessments. Section 5 is about medication errors and discrepancies. In this section, you will learn the medication discrepancy and procedure, the medication error and procedure, procedure for responding to medication error or discrepancy, and what is in place to minimize the errors and discrepancies. Medication discrepancy and procedure. A medication discrepancy occurs when a medication or treatment is not charted. A medication discrepancy also occurs when a medication or treatment is given incorrectly, as described below. This directly corresponds to the 7 rights: the wrong person, wrong time, incorrect dose, incorrect route, wrong date, or not given at all. Staff are responsible to check that medications were given at the start of his or her shift by checking the monthly medication sheets during the double check. Staff will check for any discrepancies at each medication time as well. When a discrepancy occurs, staff will contact the site program director immediately. If unavailable, the staff will call the emergency contact person. The site nurse, if there is one, will also be contacted in the event of a discrepancy. If the site does not have a designated nurse, the healthcare provider can also be called. A medication treatment and discrepancy error form will be completed. The discrepancy will be documented in the health progress notes by the staff person that discovered the discrepancy. The site program director or emergency contact person will follow up with the IDT or interdisciplinary team members as indicated in the person's program plans. The staff person that caused the discrepancy will receive feedback and retraining to ensure that they exercise more caution to avoid further discrepancies from occurring in the future. Medication error and the procedure. A medication discrepancy is considered a medication error if the medication or treatment was not administered as ordered by the physician. Most medication or treatment discrepancies are, in fact, errors. The exception would be forgetting to chart that medication or treatment was given and it was given correctly. A medication treatment discrepancy form will be filled out for any medication errors. The medication error will be documented in the health progress notes by the staff who discovered the error. The manager of the site or the emergency contact person will be notified immediately. The site program director or emergency contact person will follow up with the interdisciplinary team members according to the person's program plans. The staff person who made the medication error will receive retraining to exercise more caution to prevent further medication errors. It is also very important to contact the prescriber or the nurse of the site, whichever is indicated in the person's plan, to discuss the medication error and find out if there are any issues that would arise or health needs that need to be met as a result of the error. For example, if a person is given the wrong dosage of medication, you would call the prescriber or nurse to find out what steps you need to take to ensure the person's health, safety, and well-being given that error. What is in place to minimize medication errors and discrepancies? The first is the 7 rights procedure that each staff should follow when they are preparing to administer medications. The triple check procedure that is also done 3 times during the course of administering the medication to determine that the 7 rights are being met and the medications that are being dispensed are correct and given to the appropriate person. And lastly, the medication double check procedure, which is where staff are checking for each other, determining if medications were administered and charted correctly before and after each shift. Responding to a medication error or discrepancy. If the medication is not documented on the monthly medication sheet, the staff person who discovered the discrepancy will call the staff person who worked the shift and ask if the medication or treatment was administered correctly. The staff will follow the directives below depending on the status of the medication or treatment. If the medication or treatment was given, staff will follow the procedure for medication discrepancies and errors. The empty box on the medication sheet will be circled. The staff person who did not initial the monthly medication sheet will be informed to do so as soon as possible, typically the next shift worked. If the medication or treatment was not given, staff will follow the same procedure for medication discrepancies and med errors. Staff will call the prescriber for any available physician or nurse at the hospital or clinic to receive instructions on how to proceed with medication administration. Staff will document any directives in the health progress notes along with any details about the med discrepancy or error. The staff will follow the directives given by the medical professional. If the medication or treatment was given incorrectly, call poison control immediately. If a medication is given to the wrong person via the wrong route or at a dosage that exceeds what was prescribed, call the physician or any available medical professional or nurse for instructions. Follow any directives given by that medical professional. Staff will follow the procedure for medication discrepancies and medication errors. The box on the monthly med sheet will be circled and an X placed above the staff's initials for the medication administration time for the medication treatment that was affected by the discrepancy or the error. It is once again time to practice. In your student handbook, stop to review the scenario for medication discrepancy and error. Complete the practice forms and documentations for this scenario. You will be given 5 minutes to complete this task. We have now reached the point in our class where we will be testing and doing skill assessments. This is the last section of the class today. Complete the test as instructed by the trainer. In order to pass the class, you need to obtain 85% on the written exam and pass the observed skill assessment with the trainer. Exams will be scored before the skill assessment. If you do not meet the standard for the written exam, you will need to retake this course before completing the observed skill assessments. Please defer to the trainer for further instructions, and thank you for joining our class today.